And this recording will be posted to the Vermont DOC website, and it will also be shared via email as soon as it renders and is complete. So at this point, I will turn it over to Commissioner Baker. Again, please keep yourselves muted and with your video off until the time comes for questions. Thank you so much. Commissioner?
Thank you, Rachel. Good afternoon, everyone. Thank you for joining us. It's with a great deal of sadness and sorrow that I'm reporting a death of someone in our custody yesterday at the Northeast Correctional Facility in St. Johnsbury, Vermont. We sent a press release out earlier, and deaths in our system generate a lot of interest. And I thought the best way to handle this was to provide all of you the opportunity to come to a presser, and we can answer what questions we can all at once. Let me just make a quick statement here about what we know to this point. And the reviews and investigations are ongoing. They're quite comprehensive, and they'll take some time to gather all the facts and document the facts in order for us to have a picture of what occurred yesterday at the Northeast Correctional Facility. Michael DuPont, age 36, of Berry City, was found in his cell by the Vermont Department of Corrections staff on the afternoon of December 20th, yesterday, somewhere around 3 o'clock in the afternoon. Mr. DuPont was in custody, being detained on pending charges at the time of him being found. He was in quarantine as a result of entering our system on December 17th, and as part of our COVID-19 protocol, was placed into quarantine and was being tested while in quarantine. Staff members found Mr. DuPont and removed a sheet from his neck and tried to revive him. And EMS was called. The local EMS arrived and transported Mr. DuPont to the local hospital in St. Johnsbury, where at some point in time later, he was pronounced dead. The official cause of death will be determined by the Vermont State Medical Examiner's Office, but at this time, the suspected cause of death is suicide. We immediately followed protocol and notified the Vermont State Police and the Vermont Defender General's Office, Prisoners' Rights Office, as required by both protocol and statute. They will be conducting separate investigations in conjunction with the Vermont Department of Corrections internal review, which includes a administrative review to determine if protocols were followed, a review of medical records by our medical director, a review by our medical provider, Vital Court, and then a third-party review of the medical piece of the review. This is the second incident of self-harm in the system within the last 6 months. And it leaves me as the commissioner greatly concerned about incidents of self-harm. We've activated the Vermont Department of Peer Support, our peer support team, to support our staff. And our staff that was involved in this tried very hard to revive Mr. DuPont without success. And they're affected by this incident. And many of those staff members we put on administrative leave last night. Our peer support team was activated, and our department clinician was activated to provide support to them. And the final point I will make to you is that I did speak with Mr. DuPont's mother today, where I offered her my personal condolences, the condolences of the Vermont Department of Corrections, and my commitment to her that we would investigate and review what occurred here and brief her at some point in time in the future about what occurred. I've also directed our Office of Constituency Services to provide continuous support to Mr. DuPont's mom in order to support her during this trying time. And so those are the circumstances as we know them right now. And we thought best, instead of all of you trying to call us with questions, that we would provide this opportunity to meet with me and open it up for questions. I will try to answer the questions best I can. There's still a lot that's not known that is being investigated and reviewed. And I will answer questions best I can. And if I don't have the answer and can't provide the answer, I'll let you know. But if I don't have the answer, just because I don't have it, Rachel will get back to you with the answer after the presser. So with that, Rachel, I'm going to open it up to questions.
Yes, sir. Okay, I will be calling on you in the order that you RSVP'd. If you don't have a question, please just state no question. So first up is Fox 44, ABC 22, Brooke.
No question.
Thank you, Brooke. Next, we have Eric Blaisdell, Times Argus Rutland Herald.
Good afternoon.
Good afternoon, Eric. How are you?
Good. How are you?
I'm well, thank you.
So you said the manner of this was suicide. Can you say how this happened? Did he hang himself? Did he bring something with him and cut himself?
I'm saying that it's the manner of death is believed to be suicide, pending the investigation. It's undetermined. It's not it's not determined to be a suicide yet, but we suspect it was a suicide. And as I stated in my statement, this was the result of what appears to be use of a sheet in order to, that's the way he was found, with the sheet around his neck.
So if it isn't suicide, or is there investigations into anyone he might have been in contact with?
He was not in contact with anyone. I'm saying that, until the medical examiner rules it, I'm not the person to determine the manner of death.
I understand.
I'm describing to you what we suspect happened.
Okay. All right. Thank you.
You're welcome, Eric.
Thank you, Eric. Thank you, sir. Next, Greg, County Courier.
Hi, Greg.
Greg, do you have a question?
No, thank you. Thank you for calling on me, though.
Of course. Next, we have Liz, NBC5. Liz?
No question.
Thank you, Liz. Next, we have Jeff or Daniela from WCAX. Jeff or Daniela, are either of you on? Okay, we will return to you. Next up, Ellie from VT Digger.
Hi.
Hi, Ellie. Hi, Ellie.
So I'm curious if during this intake quarantine period, if Mr. DuPont was totally alone, and if you've had any other problems with inmates' mental health during that period of isolation.
Mr. DuPont would be by himself in quarantine as a part of the entry into the system. And we're well aware of the challenges around our quarantining of individuals as they come into the system. And so we're aware of the challenges around the mental health piece as a result of people being in quarantine and being by themselves.
And is there anything kind of to combat that? Any kind of, anyone to talk to or anything like that?
Yeah, we our mental health folks visit with the folks in quarantine on a regular basis. We try to provide them with activities such as a tablet that has access, paper, pens, other devices to be able to occupy their time. But what I will tell you, which I didn't share in the beginning, because of what you're asking me, is that we have a protocol that we check on folks in quarantine every 30 minutes. I've directed staff last night to move that up to 15 minutes. And I talked to Defender General Matt Valario today, and we're going to start a conversation about bringing some experts together in the field of mental health treatment to try to talk about taking a look at our process and the isolation that people end up in when they're by themselves entering into the system. So there's further discussion that's going to occur on that.
Thank you.
Thank you. Todd, Caledonian Record. Todd, do you have a question? We will revisit that one. VPR, Liam. You have a question for the commissioner?
I do. So you were talking about the protocol that you have of checking on inmates every 30 minutes. Was that being followed in this case? Do you have confirmation that they were checking on him, and how long? So he's there for a couple of days. Was he being checked on every 30 minutes? Do you know that for sure?
Well, what I will say is that's the protocol, Liam. It was the protocol. I directed staff last night to move that up to 15 minutes, as I said. Early indications are, and again, this is part of our administrative review to make sure protocols were followed. I don't want to say with certainty the entire time he was there that was we haven't verified that yet, but that would be the expectation. I do know leading up to the incident last night that we believe that he had been checked out according to protocol.
And Mr. DuPont had been in custody for a couple of days, starting on December 17th. Was there any indication, was he talking to staff at all? Did he give any indications that he might be considering harming himself? Do you have any information on that at this time?
We followed protocol on a screening device that we use to screen him for self-harm. And I know that mental health staff had checked on him. I don't have the answer to your question only because that's part of the administrative review, and I don't have those facts yet, William.
Is there video footage of him in the cell or audio recordings that would be able to corroborate any of that information?
That will be part of the review, as you know, and the rest of the media knows that our facilities are heavily covered with video, and we have recovered video as part of the investigation.
Have you reviewed? I know this just happened, but have you been able to watch any of it in the hours or so?
I have not, but I plan on doing that. But my senior staff has looked at the video.
Okay, and then just finally, you mentioned that staff that were involved in this are out. Are those strictly on leave because there's an investigation, or?
It has nothing to do with the investigation. It has to do with the trauma that they're exposed to when they valiantly try to save someone's life.
Okay, thank you, Commissioner.
Thank you. Next, Mike Donahue.
Thanks, Rebecca.
Good afternoon, Mike.
How are you?
Rachel.
Well. Sorry. Number one, what pre-existing mental health issues did Mr. DuPont face beforehand? I mean, had there been past cases? Were you aware of that? Any depression or anything that you had been alerted to, or not you, but your staff, DOC?
At this point, I'm not aware of any, Mike.
So there wasn't anything.
I'm not saying there wasn't any. What I'm saying is I'm not aware of any right now.
That had been brought. Okay.
Correct.
Can you talk about? You said this is the second, I assume, reported incident of self-harm. What was the basis of the earlier case?
That was a case that was in the Newport facility back in July, where an individual, our staff got to them in time and were able to revive them and save them.
Okay, and just to Liam asked this, but just to be clear, you haven't looked at the camera, but what have you been told that it shows?
What I've been told by the senior staff that looked at the camera is that our staff worked valiantly and with a great deal of professionalism to try to revive Mr. DuPont. That's what I've been advised, Mike.
Okay, and what did they tell you before that valiant effort? What did the cameras, did they see on the cameras?
Again, I was not advised of what they saw before. Again, the way the facility is set up, you know, he would be inside a cell with a door closed. So I don't have that information right now, Mike.
Can you get that to us?
Can I get what they saw before?
Yeah.
Yeah, I think, Mike, that I would want to do that in the context of the entire review. I'll be more than happy to do that when the review is complete.
Okay. And last thing, when you say he was in quarantine, what does that actually mean? Is there a wing that you quarantine people in, or is everybody together in there that comes in new and then they're moved to other cells, or how does that whole thing work?
So again, you know, as you all know, we have one of the cleanest facilities, jails in the country, jail system, when it comes to COVID-19. Early on, following guidance from CDC and the Vermont Department of Health, we created a protocol that anybody new entering our system that's new would be put into quarantine for 14 days. And we test them, I believe, at day 0, day 7, and day 12, just because of the way the virus develops. And so when they're brought in to the system in quarantine, they're separated from the rest of the population and by themselves because of the nature of the virus. And so depending on the facility, depends, excuse me, depending on the facility, depends where they are in the facility during the period of quarantine.
And are they moved once these inmates, they're in a cell, are they moved out of those?
Once they clear quarantine,
yeah.
Once they clear quarantine, Mike, on the 14 days, which is the CDC standard, then they're brought into general population if they tested negative.
And last thing, these cells, these are closed door cells. I mean, it's not like bars with people in between or anything. These are complete closed off rooms.
Again, I'd have to get back to you because again, I'm not, I'm not completely familiar with every facility in the state where the quarantine is, but they are by themselves and not interacting with other individuals.
Great. Thank you as always.
Thank you, Mike.
Thank you. Last on the list before we return to those who didn't respond, we have Sasha from 7 Days. Sasha?
Thanks, Commissioner.
Good afternoon, Sasha.
Good afternoon. Just a couple questions here. Just off Mike's questions, you mentioned the testing for inmates. Do you know if Mr. DuPont had been tested for coronavirus, and if so, what the result was of that test?
Well, first of all, anybody that comes into our system is tested, as I said, day 0, day 7, and day 12. I could not comment because of privacy issues if what his test results would be.
Okay, but so he was tested, but we
just like everybody that comes into our system, day 0, 7, and 12. Yes.
Okay. And do you have any idea, or can you tell us what he was in for, what the pending charges were?
You know, Sasha, I was told, and I don't have them right in front of me, but they were pending charges, I believe, out of Washington County. I'm not 100% sure what those pending charges were.
Okay. And you mentioned that staff tried to revive him. Was he unresponsive, unconscious then when staff arrived?
He was unconscious and unresponsive, Sasha.
Okay.
Staff to him.
Okay.
Sasha, I want to emphasize, because somebody asked this earlier, I just have to be really clear about this because I don't want any confusion about this. The reason why we put staff on administrative leave is as a result of being exposed to a traumatic event such as this. And it's a new process that we're following in order to provide better support to our staff when they're exposed to trauma, just so we're clear.
Sure. And then finally, this death comes exactly a week after another Vermont inmate, Roberto Vargas, died in Mississippi. Any update on his cause of death at this point?
I do not have any results back from the Mississippi Medical Examiner's Office, so I can't comment on that, Sasha.
Would it be fair to say you've ruled out self-harm, though, if you're saying the only other incident was this one 6 months ago where someone was revived?
I wouldn't say we ruled it out yet, because I'll say the same thing I said earlier when I was asked about this current situation. The legality of it is it's the medical examiner that determines the cause of death and the manner of death. And so for me to comment otherwise would be undermining exactly what the expertise of the medical examiner is. And I would say the same thing about the medical examiner in Mississippi. It's not my place to say either manner or cause of death. But in the situation in Mississippi, as we said in the press release, for us, it does not appear to be suspicious.
Okay. I think that's all I have. Thank you.
Thank you, Sasha.
Thank you. I'm going to return to those in the queue who indicated they had questions. WCAX, are you on the line? Do you have a question? Okay, hearing none. Todd from the Caledonian Record. Do you have a question? Okay. Is there anybody else on the line that is from the media who has a question for Commissioner Baker? If so, please unmute yourselves and announce yourself.
Rachel, is it fair enough to, I see Rory Tebow's on there, to get a comment from the state's attorney, since that's where the burglary case was pending?
Mike, I would urge you to reach out directly as opposed to on this venue. This is a Department of Corrections press conference.
Yeah, I would appreciate.
He could answer what the commissioner was unable to answer, I would assume, and it'll
Mike,
save 20 phone calls.
Mike, I would ask you to go directly with the state's attorney on that.
Thank you. Okay, so hearing no other questions, if there is someone who was unable to unmute, please email me your question and we will be sure to get you an answer to the greatest extent that we can. And this recording will be posted to our website, hopefully within the next hour or two. And again, thank you for joining us. We will keep you all posted, and please stay safe and healthy.
Thank you folks for joining us and your patience. It's appreciated.